Hi, Erin here, performing Prac 32, assessing post-operative pain. So our little patient that we're doing today is JD. He's a little Chihuahua cross who's unfortunately suffered some dog fight wounds and was a little bit shocky. So he's been in, we've stitched him up and we're just managing his pain now. So I did perform some checks prior to doing this assessment. So his gum colour was pale pink, so for physiological. His heart rate was also 200, which is above that average. His rest rate was also 44, again, a little bit above that average. And temp was also 37 when he come in. So he was that little bit shocky. So we have started some pre-active warming as well, just to try and help get him a little bit more comfortable. And for his behavioural ones, so he is a bit reactive when you go in to touch him and go in and say hello. Hey, you big little man. So he is quite sore. He has been groaning and also just laying there non-responsive, shaking, and just generally quite uncomfortable. He does get a little bit snappy when you're trying to clean his wounds, which is totally fair. So our clinic doesn't do a pain scale as such, so I've chose for this assessment to go with the Glasgow composite pain scale. So I've got all his paperwork filled out here, his name up the top, reason or procedure, so dog fight wound stitch up. So going off our little sections on the paperwork here, looking at the dog in the kennel. So to me, he has been groaning, so I've marked him as a 2 here, and he's not looking at his wounds to lick them now, so I'll mark him as a 0 for that one. So he's not looking at the wounds, he's not licking them, rubbing or chewing them. So he is a little bit more comfortable, which is good. Because I'm not going to go ahead with section B, as he has ripped the muscle off his scapula, so I'm not going to make him walk around on that one because that's a little bit rough. So we'll go ahead straight to C. So if he has a wound or painful area, apply gentle pressure 2 inches around the site. So just where we've stitched him up. So he does flinch away from it there. So I've marked him as a 2 on the scale. And overall demeanour of him, he is depressed and non-responsive really. He's not really wanting to interact with me when I'm putting my head in there and saying hello to him. And the body, how he's carrying himself as well, he is quite hunched and quite rigid. So I've marked him as a 3. So all up, that gives us an 11. So usually on a pain scale, anything above 5 is when you start administering analgesia. So I have spoken to the vet, I communicated verbally with them, and I've also written his parameters on his cage card as well. And the vet has given me permission to give him some Metacam as well. So we're going to go ahead and draw up 0.15 mils of meloxicam to give him subcut to hopefully help manage his pain a little bit better, and see, we'll judge the response from that one and possibly give him a little bit more if need be and go from there. Cool, thank you.